If you have a family history of type 2 diabetes, you're more likely to be at risk for developing metabolic syndrome or prediabetes. But if you do develop prediabetes, the good news is that it can be reversed. Let's talk a little bit about what is exactly prediabetes. Well, it's not actually a specific diagnosis with a medical treatment per se. Rather, I would encourage you to look at it as a zone of risk in your life where you go from having a normal metabolism to being at a higher and higher and higher risk for developing full-on diabetes. And this means that you're heading to trouble, but not yet at the point of no return, which is why we're talking about reversing it. So what is prediabetes? Well, you can think that it's practically the same thing as metabolic syndrome. Now, metabolic syndrome is when somebody has a constellation of these health issues. Number one, high blood cholesterol, high blood lipids. Number two, high blood pressure. Number three, high blood sugars. And by the way, you measure blood sugars with a specific blood test that looks for something called hemoglobin A1C, which your doctor can order. All right, metabolic syndrome, also expanding waistline. So if you think about your body as having a tube, right? So if you cut yourself sideways and turn it on the side, you get a tube. And when you're actually getting extra body fat, it's swelling the tube, stretching the tube, and the waistline around here is going to stretch up, all right? Expanding waistline means you're growing more and more visceral fat inside the tube of your body. And this is the kind of fat that when you have too much of it is dangerous because it's inflammatory and harmful. Pretty much interferes with everything from your appetite control to your abilities of your body to control blood sugar and many other hormonal aspects related to health and well-being. All right, so you don't want too much visceral fat. And by the way, metabolic syndrome doesn't just suddenly develop. In fact, it sneaks up on you over the course of months or years. If you have a family history of type 2 diabetes, you're more likely to be at risk for developing metabolic syndrome or prediabetes, but that's not a given. Many people who have parents or other relatives who have diabetes have dodged getting it. And we're going to talk about what you can actually do to avoid it. But if you do develop prediabetes, the good news is that it can be reversed. That's right. Prediabetes is just one of those health conditions that if you let it go and watch it get worse, it will develop into full-blown diabetes, one of those chronic diseases that nobody wants to get. And even if you develop type 2 diabetes, it is still possible to reverse it, but you need to understand how to do this, okay? So let's talk about disease reversal and how it used to be thought to be impossible, but we're discovering more and more that we can actually reverse diseases. Let me give you a couple of examples. Cancer being, to me, one of the most dramatic examples. When I went to medical school, I was taught that, if you diagnose cancer late in the game where it's already spread, pretty much it's going to be game over for the most part. And the treatments that are given might work for a little while, but unlikely to work for a long time. And that's chemotherapy, which has terrible side effects, very severe side effects for the benefit that it actually can generate. But ultimately, the cancer is going to spread and it's going to win the battle. Well, we're now discovering that you can reverse cancer by arming the body's immune system using a cancer treatment called immunotherapy. Now, immunotherapy is one of the most natural treatments in the world because it's not chemo. It doesn't kill the cancer cells directly. What it does is it prompts your body, it jacks up your body's own immune system so that your own immune system can go after the cancer. And in fact, there are many patients who have advanced cancers who get onto immunotherapy, and if they are a responder, and that's an area of research I'm working on, how do you make people better responders? If they respond to immunotherapy, literally, the immunotherapy can arm their immune system to wipe out, scrub out all cancer. So my own mother actually had endometrial cancer, became stage 4, and she had immunotherapy, and she went from stage 4 to stage 0. And 10 years later, she is perfectly healthy without any sign of cancer, never had chemotherapy. So the impossible is becoming possible, and we're able to do things that we never thought we could do. So that's an example of disease reversal.
Hey there, check this out. I've got a guide for you. It's about 3 foods to fight diabetes, and it's free. In the guide, I share simple, easy to use ingredients that you can add to your meals starting today. These are the foods that I eat myself, and they're packed with healthy bioactives that support your metabolism and help prevent insulin resistance. My guide is yours right now, free in the caption below. All you've got to do is click the link below the video. Now, let's get back to the other video.
Here's another example of disease reversal, which is heart disease, right? We used to think, and I was taught this in medical school, that if you had coronary artery disease, atherosclerosis, narrowing of the blood vessels, feeding everywhere, but feeding your heart and your brain, that eventually you're actually going to wind up continuing to build up that clogging of the arteries until the blood flow is so poor that you're going to wind up actually having a heart attack or a stroke or some other catastrophic event, right? And so that's when you have to break out the roto-rooters and open up and put a stent in, or maybe do bypass surgery, et cetera, et cetera. Well, now we know that it's possible to reverse heart disease using diet and lifestyle. And this was the pioneering work of my friend and colleague, Dr. Dean Ornish, who actually showed that even if people have very, very narrowed blood vessels, that if they embark on a intensive lifestyle regimen with good diet and exercise and stress modification, that you can actually reverse, you can actually improve the blood flow without the need for a cardiology intervention, right? By an interventional cardiology, by putting in a stent or a balloon. That's quite amazing. We're also realizing that you can reverse Alzheimer's disease. A recent clinical study that Dean Ornish also performed at the Preventative Medical Research Institute involved 51 patients with cognitive disorder and Alzheimer's, and it showed that you can actually reverse the degree of cognitive deficit and slow the progression of it using intensive diet and lifestyle change. In fact, the same diet and lifestyle changes pretty much that are beneficial for heart disease as well. Now, more research needs to be done for all of these conditions, but we know for sure that it's possible to prevent type 2 diabetes by reversing pre-diabetes. So the goal is to reverse the problems of metabolic syndrome and to tip your metabolism back into its normal zone. Now, in pre-diabetes, you have insulin resistance, which means that your body's unable to process blood glucose, which is what insulin's role is. So if you're resistant to insulin, your blood glucose is going to go up and your blood glucose is going to run high, all right? And high blood glucose is dangerous for a number of reasons. One of the reasons is that your body is going to try to produce more insulin to make it draw that sugar in. But again, because your body's insensitive to it, it's time to create more insulin. So this is actually a vicious circle of actually more and more insulin, but less and less effectiveness in drawing blood sugar in. So what can you do to regain insulin sensitivity? All right, that's a very, very important thing. Now, obviously, eating less sugar, less candies, cakes, sweets, pastas, carbs, eating less of that stuff is going to be helpful, but that's only one thing. You have to reboot your body's sensitivity to insulin. And type 2 diabetes is basically a state where your body can make insulin, but it doesn't respond to it. So your blood sugar goes up, 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 and you're not storing that energy. Even though it's in your body, it's in your bloodstream, you can't store it into your muscles and you can't store it into your fat. Now, remember, high blood sugar is dangerous and it sets you up for everything from cataracts to heart disease to kidney failure, even to dementia, we think. So you have to reverse this if you want your health back. This is one of the reasons to actually try to reverse prediabetes. All right, the first thing you do is to get physically active. This is one of the most important steps. Now, many of us actually do regularly exercise, but a lot of us don't get enough exercise. And let me tell you why this works to reverse prediabetes. Number one, exercising has been shown to help your body regain insulin sensitivity. All right, now your insulin's working. Now your glucose is being drawn into your muscles. All right, not only is your metabolism actually right-sizing, but you're needing to make less and less insulin. All right, and what that does, puts less burden on your pancreas. It actually creates less insulin-like growth factor, which can actually trigger dangerous processes, including cancer. And the specific kind of exercise you want to do to reverse prediabetes is aerobic exercise, where you get your heart rate up. You want to increase your body's use of oxygen and work your major muscle groups. And you could do this with walking, brisk walking, dancing, running, using a treadmill, getting on an exercise bike, or even better yet, go outside and get on a real bike trail. And this has been shown. An analysis by researchers at Harvard Medical School and 2 universities at China looked at 10 randomized controlled trials involving a total of 815 people. And these are all the people with pre-diabetes. And what this analysis showed is that aerobic exercise 3 to 4 times a week clearly and significantly improved insulin sensitivity, meaning it lowered insulin resistance. It improved blood glucose, which is reflective of insulin sensitivity. It improved body mass index, or BMI. BMI is just one measure of your overall metabolic health. It's still useful. Now there's about BRI, body roundness index, but this study actually looked at improved body mass index for metabolic health, and actually exercise had a benefit. All right. Now, the second thing you can do to reverse prediabetes is cut out all of your ultra-processed foods and sodas. Now, this really refers to junk food and soft drinks, which a lot of people consume, all right? And not only they consume it, they consume a lot of it. So my guess is that regardless of your health, you might have consumed one of these foods, ultra-processed foods, or a soda every now and then, maybe more often, and maybe recently. But if you want to reverse prediabetes, it's time to cut them out completely. Now, let me explain to you how all this works. In addition to all the empty calories that junk food, ultra-processed foods deliver to your body, empty calories means you get the sugar, you get the calories, but you don't get any of the polyphenols, you don't get any dietary fiber, you don't get any of this other good stuff that's in whole plant-based foods. What ultra-processed foods deliver are chemical preservatives and artificial coloring, artificial flavoring, and sometimes artificial sweeteners that damage your gut microbiome. That's your healthy gut bacteria. And your healthy gut bacteria is really important for insulin sensitivity. In fact, it streamlines your glucose efficiency, how well your body is able to, your metabolism is able to bring blood glucose from your bloodstream into your body through insulin. Ultra-processed foods can damage your gut microbiome. And if that function is damaged, then you're not going to be as insulin sensitive. You're going to become insulin resistant. All right. Your blood glucose is going to rise, and then your body's going to make more insulin to try to chase it down. It's still not going to work. All right. So harming your gut microbiome is bad. Ultra-processed foods and sodas and diet sodas can also damage your gut microbiome. So you don't want to do this. If you want to reverse this problem, stop eating ultra-processed foods and stop drinking soda and other sugar-sweetened beverages, and stop artificially sweetened beverages and foods as well. All right. So what's an ultra-processed food? You know, this has been talked about so often now, but I can tell you from my perspective, it's basically food made in a factory with a huge number of ingredients and lots of chemicals added that you can't pronounce and probably don't know what they do. The easier explanation is, if your grandmother wouldn't recognize the ingredients as food, it's probably ultra-processed. All right, so just avoid those. Cut those down, cut those out. Very important if you want to actually reverse prediabetes. Here's the third thing you can do. Switch to a predominantly plant-based diet. First food is avocado. Now, avocado actually is really, really great for gut health because it is loaded with dietary fiber. And the dietary fiber from avocados feeds your healthy gut microbiome. And a healthy gut microbiome lowers inflammation, which is actually a problem in diabetes because the diabetic state makes your body inflamed. It's pro-inflammatory. The other thing that avocado does is actually makes your body more sensitive to insulin. And this is really important if you have type 2 diabetes. It allows your body to actually draw in that fuel, that energy from sugar and carbs that you might have in your diet as well. So, avocados. How do I like to have avocados? Well, listen, I like them very, very simple. If you get a nice ripe avocado and you peel it, and you can actually just take out the pit, you can actually eat it with a spoon. sprinkle a little bit of salt, squeeze a little bit of lemon on, and you actually have something really, really delicious. Or, of course, you can spread it on the toast. The old avocado toast trick. Great for breakfast. Okay, food number 2, goji berries. You know those little red and orange berries that you'd find in an Asian market? Well, these are considered herbal medicines. They're actually used in China as tea. Guess what goji berries do? Goji berries actually have something called lutein and zeaxanthin that's good for your vision, good for your retina. Now, why is that important? Because people with diabetes are at risk for vision loss. This is from diabetic retinopathy and other forms of retinal disease. This is a disease in the back of your eye where all the blood vessels actually are. Diabetes actually makes your blood vessels not so healthy, and lutein and zeaxanthin in goji berries are actually good for protecting that retinal lining. So, number 2 is goji berries. Number 3, broccoli sprouts. Broccoli sprouts actually boost your immune defenses, and diabetes is a state where your immune system is actually depressed. It's an immunocompromised, immunosuppressed state. So anytime you can actually do anything to boost your immune system, that's a good thing. So how do you do this? Well, broccoli sprouts are basically baby broccolis. They're only 3 to 4 days old. But guess what? Broccoli has something called isothiocyanates or ITCs, and these are immune boosters. And broccoli sprouts have 100 times more of these ITCs, these helpful immune boosting bioactives. And studies have actually shown that if you actually have broccoli sprouts after getting a flu vaccine, for example, you can boost your immune response by up to 16 times. And so this is a really, really powerful way of actually supporting your immune system. I like to actually use broccoli sprouts right onto a salad, sprinkle some on. It's a great way to actually do it. But if you actually don't want to deal with the sprouts, you can just throw them into a blender and make a smoothie out of them. Add them to whatever smoothie you're going to actually have. You're going to actually make it more immune potent.
Hey there, are you ready to use food to improve your health? I do cover a lot in my YouTube videos, but there's only so much time to dive deep into how to use food as medicine. That's why I created my Eat to Beat Disease course. In my course, I walk you through how to use everyday foods that you can find in your grocery store to boost your body's health defenses. This is all based on my research, and everything is rooted in science. And I made it super easy to follow with practical everyday tips. Whether you're trying to prevent disease or just want to optimize your health for longevity, my Eat to Beat Disease course gives you all the tools to make it real and to help you get lasting changes that will help you live longer and live better. To learn more, click the link below or scan the QR code on the screen. I can't wait to get started together in my course. Now, back to the video.
All right, food number 4, if you've got diabetes, is seabass. What am I talking about? Seabass is a fish that contains healthy omega-3 fatty acids. And what omega-3 fatty acids do is they actually help to improve your stem cells. They protect your stem cells. And in diabetes, that high sugar state actually stuns the stem cells in your body. Now, I write about stem cells in my book, Eat to Beat Disease. And I talk all about how diabetes can actually compromise your stem cells. You need those stem cells to regenerate your heart, your blood vessels, all of your organs, and diabetes suppresses it. Eating sea bass with omega-3 fatty acids actually protects those stem cells, which can be really, really important for healing if you've got diabetes. Now, here's the other thing that is more recent research has shown that sea bass contains peptides. These are little fragments of proteins, okay? And these peptides can actually stimulate wound healing. And wound healing is an issue that every diabetic needs to be aware of because as their blood vessels are compromised in diabetes, it's really easy to actually have a situation called neuropathy. Neuropathy is where your nerves don't work properly. So think about what happens in your foot. If you actually step on a piece of glass, thumbtack, and your nerves are working properly, you're going to pull back, right? You're not going to step on it, and then you're going to look at your foot and you're going to clean it off and put a Band-Aid on it. Diabetics actually can't feel that injury because their nerves are actually dulled or even dead. And then what happens is that you step on something sharp, you don't feel it, you create a wound. That wound, you don't even know you have it, gets infected, and now you don't have enough blood vessels to be able to heal that area. Diabetic wounds in the foot are a big deal. In fact, they are called chronic wounds because they often don't heal, and they keep on getting infected and unhealed. That can lead to an amputation. So, one of the foods that you might want to eat if you've got diabetes and you want to protect yourself from wounds and you want to protect your stem cells is to actually have seabass. How do I like to eat seabass? Well, there's so many different ways you can eat it. I can tell you, I write recipes in my book, Eat to Beat Disease and Eat to Beat Your Diet. I think that Eat to Beat Your Diet has a recipe for steamed fish. You can put it into a steamer, all right? Just a nice chunk of the fish. Steam it up then with a little bit of soy sauce, a little bit of sesame oil, slice some ginger up right on top of that. Steam it just for about 10 minutes. It'll be done. And then you can put some soy sauce on top of it and even some really hot smoking oil. Pour it on top of that. Garnish with some chopped scallions as well as a little bit more soy sauce. That is a way in order to be able to create nice sea bass. You can also pan saute it. You can grill it. Lots of different ways to enjoy sea bass. Just go and Google it and find out sea bass, a recipe, and watch a video having somebody show you how to actually have this healthy fish to put on your plate if you've got diabetes. And the fifth food you should actually have are seafoods, other types of seafoods that can have omega-3 fatty acids. Now, obviously, you can actually have mackerel and anchovies, salmon. Those will have the omega-3s, but I bet you didn't know that clams and mussels and oysters, which many, many people love, also have omega-3 fatty acids. So, and again, those omega-3s protect your stem cells, and they actually promote healing, and they actually help level off your blood lipids and lower inflammation as well. Again, these are all issues that you want to think about countering if you have diabetes. Okay, so what's my favorite way of actually cooking clams or mussels? You know what I do? I actually take a kettle, or I take a pan, put a little bit of olive oil, if you want to chop up a little bit of garlic, and just put clams right in there, or mussels, and get the oil nice and hot, okay? And then you'll start cooking the clams or the mussels, and as you sort of get the pot super hot, or pan, you put a lid on it, and just sit back, all right? And the juice inside the clam or the mussel will actually boil and pop open the clam or mussel when it's actually finished cooking and release all those juices. You want to throw a little dash of white wine in there. That's another little delicious trick. And now you've got freshly opened, freshly cooked clams and mussels. Another way of actually getting very, very important marine omega-3 fatty acids. And that's it. I hope you enjoyed watching this video. Thanks for tuning in. Hey, if you like that video, then you're going to love this one. Check it out.